Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about frostbite injury. So the idea with frostbite is we're going to answer these four questions. Number one, what is it? Frostbite is basically a freezing of the tissues. It usually presents as starting to get cold, then you get some numbness, then you get some tingling, you can get some hardening of the tissues, you can get actually where they start to turn white or gray or even black if it gets severe enough. And usually it occurs at the extremities, or the tips, the fingers, the nose, the ears, and the tips of the toes. And it can be pretty problematic in that kind of situation. Number two is, why does it happen? It's basically you fail to maintain the temperature in that extremities, and because the blood flow to those is less than the other areas, if you get cold enough, the blood flow will be pulled away from that area, and you'll start to get frostbite, and you'll start to get the injury to those tissues. What can you do for it at home? If it's a mild case, you can actually do a slow warming, and that will actually prevent it from being a long-term injury, a long-term problem. However, if you have a pretty significant injury, major injury, then you should be seen by a medical professional so they can actually help you reduce the amount of damage that can happen, help you warm it in such a way that you don't cause other issues, and so forth. So if you have frostbite, if it's mild, you can treat it. If it's significant, then you should probably be treated by a medical professional. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 204. Thank you, and have a great rest of your night.